If it's in Hampton Roads, it's on the Hampton Roads Show.
That was good. How do you follow that? Well, your eyes and your eye health are very important in everything that you do, from driving to the store to working and relaxing and watching TV. Virginia Beach is home to the first Medicare certified and AAA HC accredited ambulatory surgery center in Eastern Virginia, dedicated exclusively to eye surgery. And here now to tell us about this wonderful resource is Dr. Samuel Garrett, ophthalmologist, founder and president of Virginia Beach Eye Center. Thank you so much for coming on the show.
Thanks for having me.
And really quick, we were mentioning your games. You were a Monopoly, Scrabble kind of guy.
We like Risk a lot because you had armies that would attack each other, you know, across Europe and try to have world domination.
Yeah,
you know,
I know.
So that was a lot of fun. So we loved that.
Well, definitely. Well, thank you for being on the show. So let's talk about the Eye Center.
Okay.
First, what was your vision when you opened it 20 years ago?
Well, yeah, so it was actually about 10 years ago. We've been in practice for about 20 years now,
Okay.
but about 10 years ago we decided to buy some land and build a building, and we actually built an eye center that actually contained an ambulatory surgery center. But in the state of Virginia, you have to have a certificate of public need in order, which is a kind of a licensing thing, to even have an ambulatory surgery center, so you can get state licensing and Medicare certification, and then other certification like HCC that you mentioned. So we were trying to put together an eye center that would be able to do everything in one place, you know, from optical glasses, contact lenses, refractive surgery like laser vision correction, which we call new-site advanced surface ablation, and also to do cataract surgery, which to do that, you know, in order to, because most patients are Medicare, you have to have Medicare certification.
Right.
For Medicare certification, you have to have state licensing. To have state licensing, you have to have a certificate of public need. So it's a huge regulatory agency that you have to go through, but we were able to jump through all those hurdles and put together an ambulatory surgery center where the patients can come in and we can evaluate them in the same building that we actually do their surgery. And it makes it very comfortable for the patient, because the same people that are actually helping us to evaluate them when we're looking at their cataracts and seeing if they need cataract surgery and other eye surgeries are the same people that go to the ambulatory surgery center and help us on that side.
Which is the nice thing, like you said, your
Right.
patients don't have to go to a hospital. You can do it all inpatient.
They see the same friendly faces that they see in the office side as they see in the ambulatory surgery center, so it's comfortable for them.
Talk a little bit about some of the types of surgeries. I know you mentioned like the cataracts, and you do everything from like contact lenses. What are some of the other surgeries that you guys
so
do
we
there?
do cataract surgery. We do something called refractive lens exchange. Nowadays, when somebody is 50 or older, instead of doing LASIK or laser vision correction, we do something called refractive lens exchange, where we take out their lens, which isn't quite cataractus yet, doesn't have, it's not cloudy, but we're doing that in order to correct nearsightedness and farsightedness and astigmatism. Sometimes even allow them to see both at distance and at near without glasses, like with the lens implant we call the crystal lens.
Okay.
We do that. We do pterygium surgery, which is a growth that comes up onto your cornea. Dr. Kramerevsky is a corneal surgeon in our practice, and she can do corneal transplant surgery there. We do new-site advanced surface ablation, which is our form of laser vision correction, much safer than LASIK as far as not having a flap complication.
Well, it seems like you guys do a lot. Definitely, you're accredited. If folks want to get any more information about where you guys are located, go ahead and let them know where you're located and how to contact you guys.
So we're right on Great Neck Road in Virginia Beach, out near Virginia Beach Boulevard, near the Interstate 2. And our phone number is 481-5555, which is easy. And the website is vbi.com, but it's vbeye.com, not VBI.
Get it? Eye health.
There you go, there you go. Yeah, it's great. You know, one of the other things we do that the hospital doesn't do, in a hospital OR you have to have an IV just to get into the operating room. And in our place, when we do cataract surgery, we just give the patient oral sedation, so they don't have to have an IV in their arm. And that's what a lot of people are afraid of, is, you know, having needles stuck in. So we don't have any needles, no stitches when we do the surgery, and it's very comfortable and very fast.
All right. Well, Dr. Garrett, thank you so much for coming on. A lot of information that you gave. So check out the website if you have any more information.
Exactly.
Thanks so much.
All right. Take care.